Hi, my name is Ravinder Kalkat. I'm a consultant gynecologist based in Birmingham. Today I'm going to talk to you about Polycystic Ovarian Syndrome. It used to be called PCOS, but uh, the name has changed and the new name is going to be PMOS, Polyendocrine Metabolic Ovarian Syndrome. This is a very recent change. There is a global consensus on this. The reason for change in name is the previous name, polycystic, was a misnomer because most patients used to think they have lots of cysts on their ovaries, which is not true. The cystic appearance was due to arrest of the follicles every month, and they do look like cysts, but they are not actual cysts. It is actually a metabolic disorder. For this reason, the name is changed, and the global consensus is that this name will be rolled out over the next 3 years. Through conferences, through engagement events, and through doctors like myself who will talk to you more about metabolic disorder when you come to my clinics. The symptoms of polycystic ovarian syndrome are period irregularities, you may miss your periods, weight gain, excessive hair growth, hair loss, acne, etc. However, it is important to remember that all the symptoms are not present in all the patients. There is a spectrum, it's a huge spectrum of symptoms, but some patients may have some symptoms and others may not have all the symptoms of polycystic ovarian syndrome or polyendocrine metabolic ovarian syndrome, which we are going to call it from now onwards. The diagnosis again is through three ways. One is clinical diagnosis, which is based on the symptoms you present with. Second is ultrasound scan diagnosis, which is based on the scan findings showing small follicles at the periphery of the ovaries and enlargement of ovaries. And then there are some blood tests, which basically look for increased testosterone levels or male type of hormones within the body. However, to diagnose this syndrome, all three may not be present in all the patients. For example, some patients may have only the symptoms and the irregularities in the blood test, but the scan is normal. Again, scan doesn't need to show polycystic ovaries for it to be called metabolic ovarian syndrome. Two out of these three criteria need to be met before we call it a polyendocrine metabolic ovarian syndrome. The treatment is tailored to the needs of the patient. Every patient does not need every treatment available. So patient involvement in decision making is the most important thing in polycystic ovarian syndrome. For example, if periods is the main problem, then starting contraceptive pills, progesterone only pills, etc. will help. However, if the main concern is excessive hair growth, then we need to work on hirsutism. And for this particular problem, I do work closely with dermatology team who can see you on the same day, or we may have to book another appointment. If the problem is fertility related, because fertility can be affected with polycystic ovarian syndrome as well, then that is a completely separate problem. The fertility is affected by arrest of ovulation, and we will need to work on that. I also want to mention about long-term consequences of metabolic syndrome. Since it is a metabolic syndrome, it can have long-term consequences for your health, including risk of hypertension, diabetes, sleep apnea, and one of the most important long-term consequences is thickening of the lining of the womb. If you don't have periods for 3 to 4 months, the lining of the womb can get thickened and it can form hyperplasia, which is a precursor to development of cancer in a long term. Hence, it is important that you have induced period every 3 to 4 months, which can be induced with the help of hormones. All the medical treatment in polycystic ovaries will help only if it is associated with lifestyle changes, including increase in exercise, loss of weight. It is difficult to achieve in the presence of metabolic syndrome, but persistence will help.